Ever wondered why urinary tract infections or UTIs are so common among women? Or perhaps you're seeking answers to why you've been repeatedly affected by this pesky infection. Let's begin by shedding some light on what a urinary tract infection is. A UTI is an infection that affects any part of your urinary system, which includes your kidneys, bladder, ureters, and urethra. While both men and women can get UTIs, they are notably more common in women. In fact, nearly half of all women will experience a UTI at least once in their lifetime. That's a significant number, isn't it? UTIs can cause a range of uncomfortable symptoms, from a burning sensation during urination to lower abdominal pain. For some, it's a one-off event, but for others, it can be a recurring issue causing considerable distress and discomfort. So let's delve into the risk factors associated with UTIs, shall we? Understanding the risk factors for urinary tract infections can help us prevent them in the future. So, what are these risk factors? Firstly, sexual activity is one of the most common causes of urinary tract infections in women. This is because sexual intercourse can introduce bacteria into the urinary tract, causing an infection. This is especially true for women who are sexually active with multiple partners or who engage in new sexual relationships. Secondly, certain types of birth control may also increase the risk of UTIs. Specifically, women who use diaphragms for contraception are at higher risk, as the diaphragm may press against the urethra and make it harder for the bladder to completely empty. This can create an environment where bacteria can thrive. The third risk factor is menopause. Women in menopause have decreased levels of estrogen, which can lead to changes in the urinary tract that make it more vulnerable to infection. Urinary tract abnormalities and blockages in the urinary tract, such as kidney stones or an enlarged prostate gland in men, can also increase the risk of UTIs. These conditions can prevent the bladder from completely emptying, creating a breeding ground for bacteria. A suppressed immune system, whether due to disease or certain medications, can also increase the risk of urinary tract infections. This is because a weakened immune system may not be able to fight off bacteria as effectively, allowing them to multiply and cause an infection. Catheter use is another risk factor. People who can't urinate on their own and use a tube, catheter, to urinate have an increased risk of UTIs. This may include people who are hospitalized, people with neurological problems that make it difficult to control their ability to urinate, and people who are paralyzed. Lastly, a recent urinary procedure, such as an examination of your urinary tract with medical instruments, can introduce bacteria into the urinary tract and increase the risk of developing a urinary tract infection. Now that we know the risk factors, let's talk about prevention. Before we continue, if you're finding this video helpful, don't forget to hit that like button. Share it with your friends and family who might also benefit from this information. Together, we can spread the knowledge and make a healthier community. And if you haven't already, do consider subscribing. We have a plethora of health tips that could be the key to leading a healthier life. Remember, knowledge is power, especially when it comes to your health. Stay tuned for some useful tips on how to prevent UTIs. Prevention is better than cure, right? So how do we prevent urinary tract infections? Let's delve into some strategies that can help keep those pesky UTIs at bay. First and foremost, hydration is key. Drinking plenty of fluids, especially water, helps dilute your urine and ensures that you'll urinate more frequently. This flushing of the urinary system can help eliminate bacteria before they have a chance to set up camp and cause an infection. Next, don't hold it in. When nature calls, answer. Regular urination is another way to keep your urinary tract free from bacteria. And when you do go, make sure to empty your bladder completely. This reduces the chances of any leftover bacteria causing trouble. A tip that might not immediately spring to mind is to urinate before and after sex. This simple action can help flush out any bacteria that may have been pushed into the urethra during intercourse, reducing your risk of a UTI. Now let's talk about feminine products. Some, like douches, powders, and certain types of contraceptive, can irritate the urethra and increase your risk of infection. So if you're prone to UTIs, it might be worth reconsidering your use of these products. Speaking of contraceptives, some methods like diaphragms or spermicidal agents can increase your risk of a UTI. If you find you're getting recurrent infections, it might be time to have a chat with your healthcare provider about different birth control options. Last but not least, for those of you who are postmenopausal, topical estrogen therapy could be an option. Low estrogen levels after menopause can make your urinary tract more vulnerable to infection. Topical estrogen helps maintain the health of these tissues, making them less susceptible to bacteria. Of course, this should always be done under the guidance of a healthcare professional. These are just some of the ways to prevent urinary tract infections. But remember, everyone is unique, and what works for one person may not work for another. So it's important to talk to your healthcare provider to determine the best prevention strategies for you. And don't forget, lifestyle plays a big part too. A balanced diet, regular exercise, and good personal hygiene can also go a long way in keeping UTIs at bay. Remember, your health is in your hands. Stay informed, stay healthy. We've covered a lot of ground today, haven't we? We began by diving into the world of urinary tract infections, otherwise known as UTIs. These pesky and often painful infections are a common occurrence, especially among women, and we've shed some light on why that is. We've highlighted some of the key risk factors for UTIs in women, from sexual activity to certain types of birth control. Knowledge is power, and understanding these risks is the first step towards prevention. Speaking of prevention, we've also outlined some simple yet effective methods to keep UTIs at bay. Drinking plenty of water, urinating before and after sex, and avoiding potentially irritating feminine products are just a few of the ways to maintain a healthy urinary tract. Remember, your health is in your hands. Thanks for joining us today. Don't forget to subscribe for more health tips. Stay safe and take care.